Excellent. So welcome again, everybody. So happy to have you all here with us today to talk a little bit about engagement and co-design with our friends from support. So we're going to do a very brief introduction of myself as well as a brief land acknowledgement. So my name is Emily Ann Opala. I'm the Knowledge and Research Lead here at the Center for Innovation in Campus Mental Health. I'd also like to share that we're all joining this webinar today on the traditional lands of Indigenous peoples across Turtle Island. I myself am coming to you all pardon me, from Treaty 13 territory, which is also referred to as the Dish with One Spoon Wampum Belt Covenant, which represents the shared lands of the Anishinaabe, the Haudenosaunee, the Huron-Wendat, the Mississaugas of the Credit First Nation, and now many other First Nations and Métis peoples. The one thing I like to say when I do these land acknowledgements is that I like to acknowledge that there are many fights happening across Turtle Island. Indigenous folks are fighting for things like land, like water, like missing and murdered Indigenous women and Two-Spirit folks. And I think as settlers on this land, it behooves us to think about the ways that we can support those fights. So with that being said, I'm just going to get into a little bit of housekeeping. So the first thing I'd like to mention is that this is a Zoom webinar. So you can see us, but we cannot see you. Other things to mention, there's closed captioning being used during today's session. If you'd like to turn off closed captioning, you can click on the CC button at the bottom of your screen and click Hide Subtitle. There's also a chat function that's available to everybody to share your feelings about the presentation, your thoughts, your insights, anything you might be feeling. It's also a great place if you're interested right now to share where you're coming from, if you'd like to share the traditional lands that you are all coming from. And if you need help with that, you can go to native-land.ca. The Q&A function is going to be used for questions for our panelists, so feel free to use that throughout the presentation to submit your questions. There will be a question period at the end of today's webinar for approximately 10 minutes. The last thing I want to share is that there's going to be a survey that's sent out to everybody at the end of this webinar, and we really do pay attention to our evaluations, so we'd really appreciate it if you all could take a moment to answer that survey. So without further ado, I'd like to now introduce Richard Adair, Betty Lou Christie, and Ethan Hopkins.
I will get the presentation up. Just give me a second. You can let me know if you can see this. We'll swap presenter view, so we are all good on that end.
Good.
Yeah, perfect. So I'm going to turn over to Betty Lou.
Great, and I'll just do like next slide. So we'll go
Yep.
to next slide. So today, my name is Betty Lou Christie. I'm the director for the Center for Innovation and Peer Support. We also have Ethan Hopkins, wave Ethan, who is the Peer Systems Navigator. And we have Richard Adair, who is the interim manager at the Center for Innovation and Peer Support. Next slide. So I have to do this disclosure thing because I have this multiple role thing going on. So today I'm presenting in my role as the Director of Support House's Center for Innovation and Peer Support. The ideas, opinions, and comments described in these slides and during this presentation are my own, and the centers are not representative nor affiliated with my current 2-year appointment as the chair of the Health Minister's Patient and Family Advisory Council. Next slide. So this is my son. I always take an opportunity to bring this to the forefront no matter where I am. Pete died of an accidental opioid overdose 20 years ago. So as most of you know, being clinicians and even being in the school environment or wherever you are, is that we have an absolute epidemic and crisis of opioid deaths. And the fact that Pete died 20 years ago and where we are now is quite disgusting to me, and a large prompt of why I do the advocacy that I do. So I just have And this is relevant to, how we go about our advocacy, because in trying to capture the complexity of our life journey, so if you're going to do engagement and the impact of systemic failures, the lack of early intervention, stigma, family cycles, and the breakdown, loss of hope and dignity, and the punitive nature of failed outcomes is hard to describe when one's intention is actually to provide evidence and not judgment. So the one unique way that people with living experience and family caregivers can bring life to evidence and indeed empower its impact is to capture the emotion, the pain, the fight to survive, the love that wasn't enough, while also showcasing resiliency, strength, and the ability of the human spirit to get up over and over and over again. When one is sharing their life journey, as we do, all of us with lived experience that you want to actually engage with or advocate with, or actually provide, and create advisories for, it's important that we share in a way that expresses what happened, but also the feeling, so that the intended audience can actually recognize how something must have felt. The complex part of that, and what we're trying to help them figure out, is expressing feeling in a way that's professional and thorough enough to break through all the politics, the differing philosophies, the biases, the judgments, the stigma, the sensitivities, and territorial issues, to actually come to consensus on how can we move this forward in a real and authentic way. Next slide. So of course, we're always going to have to speak to this because it's just so pervasive, no matter what environment we're in, that mental health and substance use addiction, stigma, discrimination, prejudice are still very much alive. It's a little bit less for mental health. It's still right there front and center for substance use addiction. And due to discrimination, prejudice, bias, and intolerance, people's lives are being ruined and families are being destroyed. As healthcare leaders or whatever clinical leaders, whatever ecosystem you're in, we have to talk about this and acknowledge it. Next slide, and I'm kicking it over to Ethan.
Thanks, Betty Lou. And we can go to next slide. I get the pleasure of sharing who we are at Support House. At Support House, our vision is to create a community where people with mental health and/or substance use concerns are treated with dignity and respect, and where housing, services, and supports are available whenever and wherever needed to positively impact wellness. Support House has a diverse portfolio of comprehensive supports, and this includes housing, support coordination, peer support, as well as service and system resolution facilitation. Next slide, please. One of the things that I'm most proud of our team for is that we really walk the walk when it comes to our shared values of supporting people. We recently went through an accreditation process, and the team that reviewed was impressed by the dedication and drive of staff to meet clients' needs. And it was very clear to them that we prioritize a person-directed approach, and other strengths noted were the strong and meaningful links and partnerships in the community, the multiple level advocacy initiatives, the excellent human resources practices and strong, committed, and resilient staff team, the impressive volunteer program, the robust privacy and confidentiality practices, the excellent strength-based client-centered approach, as well as the innovative peer support program. Next slide, please. So the center's innovation and peer support is a full peer program of Support House. And so everybody here at the center is a peer. Next slide, please. Support House's Center for Innovation and Peer Support provides wellness-based, peer-led, self-help, and social connections programming to community members and support to organizations who have peer staff through training and peer support program implementation, capacity building, evaluation, research, knowledge brokerage, and quality improvement. Growing from its original identity as a consumer survivor initiative, In 1999, then known as TEACH, the need for the support and training of agencies providing authentic peer support was identified. As a result, the center has evolved to become a benchmark of excellence in peer support and the meaningful engagement of lived experience and family caregiver co-design. Next slide. The center's provincial systems and partner stream, that's the stream that I have the pleasure of being a part of, is focused on building capacity of people with lived experience and family caregivers, people engaging in services, peer support workers, peer support supervisors, health service providers, regional mental health and addiction systems, and provincial healthcare systems. We currently support over 60 peers, 40 supervisors, and 30 programs across the healthcare spectrum. Through our virtual learning center, we provide peer staff, supervisor, and team trainings, mentoring and consultation around implementation, peer support practice, and quality improvement, our peer professional development webinar series, and provincial communities of practice for peer staff, family caregiver, peer supporters, and supervisors. The Resource Hub is home to the center's resources and external resources that we recognize as supportive to the values of peer support practice, and implementation. Our offerings are informed by peer support expertise and are created by peer supporters. And all of our resources published align with the best practices in peer support, including our validated peer support evaluation tool. Next slide. The center's peer programming stream offers quality programs that are designed, developed, implemented, and evaluated by people with lived experience. This stream is focused on providing peer-led, psychosocial rehabilitative programming for community members to build skills, develop wellness strategies and tools, and cultivate social connectedness. Our self-help groups provide a safe, non-judgmental space for supportive conversations about our individual wellness journeys. And together, we explore the impacts of mental health and/or substance use challenges on our lives and share resources, tools, and strategies that have been of support. Our social connections groups are focused on building community and relationships through safe spaces to have lighthearted, fun, exploratory conversations, share creative experiences, and play games. And our peer support navigation program supports people one-to-one when people are navigating wellness and mental health and addiction supports and would find it helpful to speak to someone who can relate to their experience. Next slide. At the center, we know the system is always innovating, growing, and shifting, and so we consistently invest in quality improvement efforts and refining leadership. The center's leadership has been trained and coached extensively in quality improvement with excellence through quality improvement projects. Leadership are also certified in LEADS healthcare leadership and certified in Lean Six Sigma yellow or green belt. And this supports us in approaching the way we design, develop, implement, and evaluate our services so that they can be of most support. Next slide. As I'm sure many of us can relate, it's always nice to be recognized for the work you do. And the center is proud to have been recognized as a promising practice by provincial system support programs, evidence exchange network at the Center for Addiction and Mental Health. The center also co-authored the 2017 Health Canada Drug Treatment Funding Program's performance measure in peer support. And the center was featured in Ontario Excellence Through Quality Improvement Report as an inspiring look at quality improvement in action. Next slide. We have also received awards in recognition of our efforts, including the 2017 OPDI Lighthouse Innovators Award, the 2017 AMHO's President's Shield Award, and the 2016 Association of General Hospital Psychiatric Services Summit Award. Next slide, please. Peer support as a professional supportive practice occurs across healthcare settings. The center partnered with EENet at CAMH to identify core elements of peer support programs across different health sectors, such as mental health and addictions, diabetes, chronic disease, and cancer care. And by identifying consistent core elements, we were better positioned to support breaking down healthcare silos. And now I'm going to pass to Richard to talk about values-based engagement considerations.
Thanks, Ethan. My name's Richard. I get the opportunity to share with you just my thoughts on, the importance of value-based engagement. We're privileged at this center that we all arrive to our employment roles as individuals with identified lived experience, and the relevance and importance of being able to share our stories to have meaningful impacts on the systems that we engage in, but also within our employment roles and the impacts we have as employees of Support House. And so values-based engagement is an approach, and it's an approach and a culture that is established by the organization that you work for in your leadership teams. So to start off, when we think about, things to consider around engagement and co-design, is this idea of inclusion, not exclusion. Of calling individuals into a space to share, and the power that comes with creating a space where they actually feel safe enough to share. And so we encourage you to consider, to be curious and open when learning about other people's perspectives, and really identifying your bias and what you bring into this space when we're creating opportunities for engagement and co-design with the individuals providing support to, or the staff that are engaging in that process. We encourage you to consider all the voices and whether all the voices are actually represented within your engagement and co-design initiative. And if they're not represented, why is that? And to question yourself and question why, perhaps there's a misrepresentation of a voice within the space, and then find creative ways to draw those voices into the spaces in the future. Asking open-ended questions enables us to collaboratively explore in safe ways everyone's unique experience, and you find we really want to drive home the importance of approaching engagement and co-design from a trauma-informed perspective. That we all arrive into this space with different things that have gone on in our lives, and really the foundations of engagement and co-design really need to be embedded in trust and safety, and also accountability. So kind of sets the stage for how we approach at Support House, the center, how we approach engagement and co-design. When we're looking at the pillars of how the center approaches our engagement initiatives, we're always engaging our service users, our staff, our volunteers and interns, our board, our partners, and our assistant leaders. And we actually listen, and we really listen to what they say. When we talk about engagement, that's really asking questions to get some information, and co-design something different. I think as part of co-design, you need all of those parties identified as part of that co-design process. Because without that, you cannot actually create something that's meaningful for all the parties involved. Whenever we approach something, when it comes to engagement and co-design, we like to utilize Health Quality Ontario's basically engagement framework, and also the tools that they have when it comes to quality improvement, so how to utilize the model for improvement spectrum. So, we're acting, we plan, we study, we do, we reevaluate, and then we revisit the programming changes that we're doing, whether that's related to engagement or whether that's we're co-designing a project together. There's all kinds of really great resources there that assist in what you do after you do your engagement, how you explore program development. We'll share some of those resources with you at the end of the presentation. And the value of beginning with values, values are the core essence of the work that we do. So translating values into action has provided a basis for training, evaluation, quality improvement, and common language to communicate how we stay authentic. We have proven that it translates through driving strategy, governance, policy, and procedures. And knowing also that human connection is the most important part of treatment and support, and being able to translate and hold people accountable to actual values and action and interactions with individuals is vital. So values, what are values? You know, values are just, you know, they're things that we approach life with, but when we can translate them into actual tangible actions, they have massive impacts on the people that we're supporting, engaging with, and co-designing with. The work that Betty Lou's engaged with in her other role has identified some key values in the Patient, Family, and Caregiver Declaration of Values for Ontario. So the Health Minister released an amended version of the Patient and Family Caregiver Declaration of Values in Ontario. Amendments were based on feedback from the current Patient Family Advisory Council members and included a focus on anti-racism, accessibility, and equitable care delivery. As part of the transfer of payment to the Ontario Health Teams, this Declaration of Values was embedded in their process and engagement framework. And so these are some key values that you can think about when you approach your engagement and co-design. The frameworks are there to utilize as you start to move towards creating authentic engagement. You know, where are we providing values-based accountability, empathy, and compassion? How are we approaching that? Where are we thinking about equity and in engagement and the voices that are not represented? How do we treat the individuals we're engaging with respect and dignity? And how are we transparent about the decisions that are made when we're engaging people in a change process, and how we feed that information back to them? Allowing core values to drive everything is how Support House works. All of us are expected to sign off on a community core values oath that ensures that our culture of values-based work is embraced, and that our behaviors and our decision-making run through all our engagement initiatives. All employees, volunteers, and board members have to sign off on this, and it's a part of our culture. It ensures that we, when we approach service, are coming from the mindset of person-directed supports, what's right for the person, letting them decide what's right for them and supporting them in that. Connection and engagement, you know, how do we start conversations? How do we maintain relationships? How do we keep conversations ongoing? And how do we utilize reflective practice to understand when our bias or our previous experience with different things are starting to impact how we approach engaging people in change process? And then health and wellness, you know, a commitment to the health and wellness of our staff team, a commitment to the health and wellness of our community. And these are the values that we sign off on as employees, and they're reflective in all our work. And we can tangibly measure these if we want to see if the impact's actually happening or occurring with the individuals we provide support to. How we apply values in our engagement and as an agency and as an employees trickles into how we make decisions, how we hire and onboard any new staff into our agency, when we're engaging individuals, both internally and to the individuals we provide services to. And then when we're thinking about, you know, embedding engagement of staff and people we support in the process for quality improvement. Everything we do is from a learning mindset. That value of lifelong learning is something that's really relevant, and encourage, you know, as healthcare, but education professionals, you would understand the value of continued education in this area. I'm going to pass it on to Betty Lou to talk about engagement and co-design specifically, and some of the strategies you can consider in that area.
Great, thanks, Richard. Next slide, please. So we really work, I mean, that front end part was really, really important, because to get the values down, all of the work at the front end is really what will make you more successful in your engagement processes and co-design processes. And if you have advisories and you're engaging with the people that you're working with, whether it be in a education field, but cross sections of, are they struggling? So we always work in the art of possibility from the values, the engagement, because that leads to the co-design, which leads to system transformation. No matter what ecosystem that you're in, it's applicable across the board. And advocacy, so giving voice, which we also call experiential expertise, can have an enormous positive impact across the continuum of care by providing a broader perspective grounded in the reality of what truly happens to people in their lives, both good and not so good. The nexus of change all through history has been those people who can speak up, and speak out in a meaningful and effective ways. It provides a cultural shift from storytelling to evidence. It ensures that involvement of people with living experience, and our family caregivers that support them into all aspects of our evolving healthcare, education system, whatever ecosystem, and the ability to champion social and systems change is really imperative. Next slide. So basically, when you break it all down to this, what is this co-design and what's engagement? It's shared power. It's quite simple, but it's really, really hard to do. It's really, really, really hard to do authentically and in a good way. Engagement is basically, it's building relationships, and co-design is the activity of that. So we really need to embrace that shared power is actually a culture shift, and it's the result of building relationships. Shared power then becomes a foundation of genuine partnership and trust, and therefore you start to see sharing responsibility for future growth conversation to drive meaningful change. So that's the North Star. Adaptability. The decision-making is distributed. Minimal structure is workable and vibrant when you're actually working from building relationships and trust. And the emphasis on relationships and connection actually becomes the driver. Next slide. So whether we say transforming healthcare through person-directed services or transforming, how you support people in your curriculum, education system, whatever the ecosystem, it's reminding everyone that engagement is about building and maintaining relationships. It sounds so simple, but it's the core. Like, it's almost like people think it's a soft skill, where actually that is the driver. Shifting minds happens through relationships. It creates that room. So co-designing with people who use your services and their families and our caregivers where it's applicable moves us towards ensuring that every person is recognized, appreciated, and respected for the unique person they are on their unique journey, and to ensure that the care provision, education, whatever you're providing for them is adaptable to the fluctuations in people's health journeys. Healthcare, education, whatever, trying to keep people well within that infrastructure. It is about connection. We all need to feel valued, respected, and treated in a dignified and empowering way. We need role models. We need people that get it to help us navigate and find our self-defined wellness. That's what nurtures hope, resiliency, and healing. Next slide. So co-design, it's listening. Again, it's really, really listening. There is actually a massive growing role for people who have engaged with healthcare services, whatever services, to share what they call stories. I like to refer to them as life journeys, to help guide the discussion toward healthcare transformation, education transformation, how you keep people healthy in whatever environments. The evolution of patient, client, lived experience, family, caregiver, resident, and or citizen voice, because we all identify differently. Students, capacity, curriculum, leaders, is an essential link in a growing conversation to drive meaningful change. A large piece of this change is well beyond the healthcare parameters and more about social change. It's where healthcare intersects with the broader determinants of health and what people need to find their wellness, maintain their wellness, sustain their wellness, whatever that looks like for each and every person. There's a need to humanize, to model recovery and wellness, highlight resiliency, but also speak to the significant system and service barriers that the unmet needs, the litany of harms that have resulted due to discrimination and judgment and bias. Next slide. So just looping back again. So once again, the importance of co-designing, whether it be with your students, with whomever that you're actually trying to serve or you're trying to provide services to. It's linking and building on relationships again. It linkages to provincial expertise, system governance, policy and planning. That's what helps to create the impact of a healthcare ecosystem for authentic engagement. So, we find it in healthcare, and it replicates across any ecosystem. This actually really reduces duplications, inefficiencies, barriers, and silos. It creates opportunity to share, upload, and download knowledge, expertise, evidence. It is foundational to co-creation, humanizing, and equity. It solidifies partnerships and infrastructure needed for sustainability. It promotes the recognition and integration of lived living experience, patients, caregivers, students, whatever we identify as a viable and valued part of person-directed healthcare. Next slide. So once again, just trying to break it down, it's basically, it's relationship building, it's shared voice, it's being able to get together behind a larger group vision. Next slide. And also recognize that co-designing is kind of really complicated because it's part of a much larger system. You know, you want person-directed care and services, but you need to bridge those dynamic and complex systems that weigh us down, that we actually need for, you know, safety, liability, and everything else that we need for policy and planning, partnering and collaboration, and networking with networks. So its quality is actually reminding people that we need to broaden our scope of what experts and expertise is, and to embrace the living expertise as another stream of evidence, which is happening across the province. People with lived living experience have been taking care of themselves in the absence of a true system that works for them for a very, very long time. No one is better positioned than we are, those of us with lived living experience, those of us that intersect with whatever ecosystem that you're providing service for, to work hand in hand to co-create what's actually needed for people. Next slide. So this is one that basically that we've alluded to before, that values-based work for meaningful engagement, co-design, and transformation. It honors the individual as a person holistically. That's really, really important. We have to be looking at whole people, not diagnosis, not problems, the whole person and what their whole life journey is about. It honors the person as an expert in their own lived experience. No matter if we're struggling or not, we have a special expertise on what actually we need, what's not working for us, and what we need to actually help us to get to the next step. It empowers the person to achieve their wellness goals. It reminds the person that they have innate, unwavering worth. That hope and that recognition will take somebody miles, absolute miles, and creates a safety, a space where safety and self-exploration may occur. Next slide. The government, with all these changes right now in healthcare, like RISE, which is the Rapid Improvement Support and Exchange, they do a lot of work on engagement and co-design. So we thought it's worth to put these in because trying to keep aligned with what's going on provincially and all this dynamic healthcare change is really important, because once again, it's engagement, it's relationships. Once again, it's co-design. And co-design is that any type of engagement. It can take many forms. It's an iterative process. It's an activity where various stakeholders come together to focus on a problem and brainstorm solutions. So although these may sound like they're simple concepts, everyone has a different interpretation of what they mean and what they look like. Next slide. So basically, as far as our healthcare parameters are, all the engagement it's population health management. It's being able to keep the whole of your population, so the whole of whatever peoples you are serving, healthy. You know, so that prevention, that early intervention, the ability to be able to react when they need something, and then the ability to be able to support them on the long term afterwards throughout their journey. And you have to look at the needs and risks, the barriers, co-designing the care models, service deliveries, implementation and reach, and then that monitoring and evaluation. It's all about population health. Next slide. This one's more around the infrastructure of healthcare, but basically what it's for, it's to make you really think about, okay, what's your ecosystem? So in the roles that you're in the ecosystem that you're in, whether it's education, you know, campus health, people struggling with their mental health, is like, you need to look at, okay, who are the people that I need to have pulled in to be able to do this engagement? Because be able to wrap around people or let people drive their outcomes takes a lot of other players. And I think recognizing who those other players are will be really important for you as you step forward on your journey. Next slide. The most important thing that everybody is learning is that you meet people where they're at, you know, so it's not necessarily driving people into, you know, you can have a separate advisory, you know, but you can actually go out into your communities or into your infrastructure there and actually meet people where they're at. Invest in, strengthen, and value relationships, be transparent, and provide options. Like one size doesn't fit all. You might do a town hall, or you might do what they call kitchen table discussions, or you might do a webinar, or you might actually have an advisory. There's all kinds of ways that you can engage and get the information you need from people who are engaging with your services. And next slide, we're getting close to the end of this part here. Yeah. The key messaging is basically, it's about all of us working together across diverse populations. We all want the best, no matter what it is, healthcare, education, it goes on and on and on for ourselves and for the people that we love and support, that our systems are always growing and changing. And it very much is that I innately think that people and systems do the best they can with what they know at the time. And when they know better, they actually do better. And part of the job engagement is for you to actually know more so you can do better. And I'll go to my last particular slide right now. And this is one that's really, did a white paper back in, oh, God knows, 2015. But it's very much true. It always comes to the surface all the time. When allowed full and equitable political and social power with meaningful involvement in healthcare governance, whatever the infrastructure is, policy development, planning, delivery, and evaluation, people with lived experience, families, caregivers, students, peers, can provide unique and relevant context upon which to work with and base decisions on. The lived experience of people, families, caregivers, peer support, on and on and on, is shaping a cultural shift from storytelling to evidence, and it provides a roadmap to affirmative change. And I'm going to kick it back over to Richard.
Thanks, Betty Lou. So just going to wrap up the presentation, just highlighting maybe some key considerations, some takeaways, some potential resources that we'll make available to you to further continue your exploration on co-design and engagement. So maximize your own resources. You have internal resources available to you within your campus. So when you're thinking about, any engagement or co-design initiative on a campus, what professors are available to you that have experience in community-based engagement and co-design? You have access to potentially professors who've engaged in participatory research and have the framework and understanding of what authentic values-based engagement and co-design can actually look like. Leverage your students, the students that are currently in the learning process to assist and build their skills as they provide support to you through engagement and co-design. And I'll use my own personal example, right? I took advertising, so I have a base understanding of focus groups and facilitating focus groups and what that looks like, So leveraging students that are willing or looking to advance their skill sets is a really great opportunity for them. Also utilizing the student bodies that already exist within your colleges and universities to facilitate engagement and co-design, potentially because they've already established some trust, and they can potentially create some safe spaces for students to participate. And likewise, any internal committees that you have with staff. I will emphasize, community engagement is important. What community members may be interested in supporting the engagement work you're doing, what skill sets could they bring to the table to assist? Also, are we engaging the community when the decisions we're making or we're co-designing some kind of change actually has a direct impact on their life when we think about our community and the campuses that potentially the community surrounds? And then another opportunity, sorry, I just switched, is to create a campus engagement committee. What is the opportunity to consider and explore a campus engagement committee that really speaks to the demographics and the population you serve, because I'm going to guess across Ontario, each campus is going to have a very distinctly different population with unique needs. And so if you can start to think about creative ways to create some kind of campus engagement committee that focuses on your local change processes, whatever you're looking to do, it might be a good segue to create sustainability. Lastly, compensation. When you're engaging with students and having them participate in engagement or supporting that, how do we compensate potentially them? Is it a voucher to buy something in the cafeteria? Perhaps it's a voucher to support maybe purchasing a book when they're in their learning spaces. So what are creative ways we can think about compensating individuals as they give their time and investment into the engagement and co-design projects you want to work on within your individual campuses? So thinking about budgets, what's creative ways to create budgets for this work to happen internally? Just some strategies to think about how you can do engagement. You can have a virtual email engagement community. You can utilize social media as an engagement platform. Facebook, Slack channel is a way to bring people into a space to have a collective conversation. Creating engagement networks regionally or program specific. Perhaps there's engagement networks with campuses that are in a close proximity to get collective shared voice on a similar experience. Virtual town hall meetings, utilizing the virtual space. The virtual platform's a great way to bring people who feel comfortable in this space together to have conversations. Engagement web portal, utilizing your website to create an engagement opportunity or co-design opportunity right on your website where potentially student staff spend a lot of time already. And then community engagement outreach, how do you reach out and how do you reach within? Some resources that might be helpful is the released in 2021 was the Minister of Health's Ontario Health Team Patient Family and Caregiver Partnership Engagement Strategy. It's a guidance document to assist Ontario health teams in implementing engagement strategies within their healthcare setting, but you can always borrow ideas within that document to support. And really the emphasis on providing timely, authentic engagement that informs meaningful change. So that's a resource that we can share or you can find online. I'm not sure if you had anything else you wanted to add into that, Betty Lou, because I know you potentially might have had some.
No, it's just a really succinct document that builds on values and principles and to consider the spheres of impact you want within your campuses.
The next resources, the engagement with impact toolkit. So evaluating the impact family, patient family caregiver engagement and health systems. This engagement toolkit is actually something that's it's available online. And it helps organizations evaluate the impact of their programs and activities. It's a resource that can be adapted to the education setting. There's all kinds of different tools within the toolkit that you could utilize or find that works for you to adapt to you. And it's available, it's online. You just click on the website. There's all kinds of tools available to support your engagement and co-design work and how to evaluate it. So something you might want to explore. We have our toolkit for sharing personal journeys for public engagement and advisory. This resource is to assist anybody who you might be working with from an engagement perspective to learn how to share their story in a trauma-informed way and things they need to consider when they're sharing their story or their journey, whether that's with the campus or whether that's actually out within their community. Our compassionate language for mental health and substance use and holding people in unconditional high regard is a really great resource to help everybody get on the same page around appropriate language and the language we use to address certain topics and certain individuals' experiences. And it can be a very impactful tool to help better position how we use words and how we minimize impact when we talk about stigma and discrimination and putting people in certain categories when, there's ways we can approach language that better support our own individual experiences, but also foster empowerment around language and how we address people in spaces. Really cool tool that was created in partnership with peers across Ontario. Lastly, the center is in the process of developing an experience-based advisory workshop that really focuses on things to consider around power and privilege, stigma and discrimination, trauma-informed practice. If it's something that you are ever interested in, you can always reach out to the center. We'd be more than willing to spend some time with you to talk about things that you might want to consider if you're approaching an engagement or co-design initiative, and you might find it helpful to just tap into some thoughts that are outside of perhaps your supports. So we're always make ourselves available to support any engagement where we can uh, as a consultant to give you ideas to think about things differently. Outside of that, all these resources, this PowerPoint will be shared with you. The resources I've identified, I'll send along with the PowerPoint slides. They'll be made available for you to continue your education as you move on beyond this webinar. I just want to thank you for your time and thank Betty Lou and Ethan for sharing this space with me. And I'm going to stop sharing now and we can go to questions and answers.
Excellent. Thank you so much to the three of you. That was a fantastic presentation, and I'm sure that folks who are here with us in the room have gotten a lot out of it. So we have one question that's come in through the Q&A that I'll share with you all now. And then just a reminder to everybody else, the Q&A function at the bottom of your screen is where you can submit your questions for our panelists. And if we don't get any more questions, I have a few that I can answer as well. So the first question that has been asked here is, how do we engage students that are not part of regular campus groups and whose voice may not be represented? For example, they're not part of a union, not currently using services as they don't feel part of the programming.
I think my quick soundbite on that is that you have to do outreach. It's absolutely imperative that you will probably have to go to where they are, as opposed to you trying to hope that they kind of evolve or come over to you, or that you can attract them. You actually have to do the extra step of going out, networking, and finding out where they are, and then engaging them in a way that they want to do, which sounds really, really complicated. And a lot of times it is, and it's time consuming. But once you start that network, then you just, word of mouth gets around. So that's one of the ways.
I would share just from my own personal experience as a student with Guelph Humber that I get a lot of emails, and most of them I don't pay attention to. So I think you actually need to be in the classroom settings, or kind of echoing Betty Lou, you need to actually do the actual outreach. When I think about virtual learning, what's the opportunities to leverage the virtual space? When I log into my online platform, it has announcements. Is there an opportunity to leverage an announcement that says we are engaging students on this? Because students will be engaging with that online platform and those announcements all the time. But I know for certain if you send something through email, personally, I don't read any of them because I get sometimes a lot of email traffic through Guelph Humber that I don't have time to invest in reading it. So I think you need to think creatively around how you approach community outreach, leveraging what's already there to reach the people that are perhaps not connected with the group. Perhaps it's setting up something in the hallway that just talks about the work you're doing, so that you can get the traffic of people walking by that might be interested, that might never actually connect with a group. I'm not sure if you have any thoughts, Ethan. I know you're in the learning process too.
Yeah, I'm also currently a student. And so I completely agree on the emails. It's not that you'll get nobody, but do something alongside emails at the very least, because there's a lot that get sent out. Social media is something that a lot of us are on as well. I follow probably 3 or 4 different Humber College accounts. It's another area where you can reach out to people. As Richard said, the hallways, anything that's happening in a hallway piques interest. Whether or not you go and check it out is one thing, but when something's going on and people are wearing shirts, you're looking over to see what they're doing. And as it's been said by both of my colleagues, actually in the class. And if you yourself as the person engaging can't make it to every class, there's a lot going on, but can you talk to staff so that staff distribute that? And so I know, having been on the receiving end, that when there's things like they want a leader from a program to be involved in something, all of our teachers will mention it in every single class that they are looking for leaders from the program to go join this engagement session or to join this committee to advise on work. And so even if your pool of people engaging can't make it to every single class, can you disseminate that to staff so that staff continue to reiterate it? And if you do enough of these things, you're going to reach a substantial pool of people from diverse demographics.
Dan, I'll piggyback on what Ethan said, because I see the next question is around larger remote environments. Anytime you can leverage the classroom setting where somebody's already there learning, you can eliminate the remote piece because they're already present. And if you have a professor that shares a link and gives student time in that space to follow through on filling it out, you're adding the engagement into the back end of already a learning environment. So we do, and an example would be, we do that in our groups. In our peer support groups, if we need to have intentional engagement happen, we factor it into the time we spend with the peers, and we give them the space to be able to fill out the survey while they're at our group, not when they leave. Most people are not going to fill something out once they've exited something. So create the space and container within the space. And if you have the professors understand what the engagement or co-design piece is about, to provide the information and to motivate follow through on clicking the link and taking the time to do it, then I think you start to eliminate the barriers that remote potentially can, that remote piece, because they're a present audience.
Right. Betty Lou and Ethan, do you have anything to add in terms of suggestions for largely remote environments?
I think, I mean, and this would be in certain exceptional cases too. I thought we did when we had to pivot due to COVID, and that is that we provided what people needed. We refurbished old laptops and phones, and for those, there was one who was living out of their car, so we got a phone card. So I mean, and there was, yes, of course that costs money and things like that, but there usually is ways to find funding for that. For just like, one-time funding is a lot easier to get things like that, particularly when you're trying to fill a void. If it's a broadband issue, then that becomes something that provincially they are looking at. Like, we have to make sure that everybody has accessibility. So in the short term, that's what we were doing as far as people who didn't have that. And that's remote, but also people who didn't have the skill sets yet. Like, we had a lot of seniors that we had to warm transfer in, or a lot of people who weren't tech savvy. And just because of the amount of work the team did to facilitate that, do the warm transfers, really work on negotiating their comfort with doing that, was extremely successful.
And I'll add in, alongside what Betty Lou's sharing, in your messaging when you're doing the outreach, address the barriers there and address how you're going to create access there. Because if I see you posting, join us for a virtual town hall, and that's it. And there are things that you can potentially do to navigate barriers, but it's not in that messaging, I'm not looking any further, because I've already addressed the barrier of why I can't do it. Now, if you say, join us for a virtual town hall, don't have data, ? Talk to us, email here. Don't have a place that's quiet, talk to us, email here, etc. If you actually address the barriers head on, then instead of people discounting immediately, you have the opportunity to actually navigate those. And so maybe it's a data card, maybe you're opening a library and there's a space people can come into to access data, etc. And so actually addressing it within is incredibly helpful, because there have been times where myself, I have received things, and sometimes it's just like the timing, and it doesn't say there's flexibility in the time of the engagement, but then later on it gets moved because somebody decided to advocate for a different time, but I didn't know that was an option. I heard that it was at this time. And so if there is room to navigate things, put that there is room to navigate things, and you will get people that actually advocate for themselves because they know it's not set in stone.
Those are great tips. Thanks so much for those. So I have one more question for you folks. And this is more for anybody really who's starting up a co-design process, a co-design project on their campus. what's their first step? What should be the first thing that they're concerned about?
I think first and foremost is that you just need to figure out what you want out of it. So, so you can scope it down so it's not this big general thing that actually has no parameters on it. So I think that's really important, that any engagement should start at the earliest point possible, because a lot of times people think, okay, I got to get a straw dog, I got to do this, I got to do that. And by that time, you've kind of shaped the pathway before you've actually allowed any input in, which may have taken it in a totally different direction. That's really important. The other thing that's really important that we know too is that to interview people, so you have to match your skill sets and your needs for what your co-design process is. That's not meant as an elimination process. It's just that you need to know where people are at. Is this the right co-design project for them per se? And what I always use an example is that it's totally different for people who are coming on to, let's say, a systems level policy table, as opposed to somebody who's going to work on a specific project that is redesigning ER that's more welcoming. Because there's a quick fix solution on one, whereas the other one could go on for the rest of your bloody life, and people end up being really frustrated. So it's kind of like getting those parameters of, okay, what do we need and what type of engagement do we need?
I just will say equalizing relationships. And I think it's super important, depending on who's doing the engagement. If they're in a position of power, are they confident enough to set their power aside for that time period to be able to meet people where they're at? And it doesn't negate the professionalism or the credentials or the role they hold. It's just for that time period, the most valuable thing is for everybody to feel safe. And if that's not the case and you can't create that space, what are your other ways of thinking about how we equalize power in an engagement setting or a co-design setting, and that we're all coming to the place for a common goal to work towards? We're all rowing in the same direction, and our hats get left at the door. So I think there has to be intentionality and thought about the culture we create when we equalize relationships. And in peer work, we do it all the time. We're in a professional role, but we equalize. So we're at the same, we're walking alongside someone and not in front of them.
And in alignment with both of the things shared, I think what I would advise is grounding yourself in why you're receiving the voice of whatever population, because that's going to align with the equal and empathetic relationships. It's going to align with the direction of your co-designing and who you're interviewing for. But actually grounding and why it is you're doing this, because if it's just to check a checkbox, probably the rest of the process isn't going to go very well. Because you're there not because you want to be there, or not because you care about the voice, but because it's a necessary part of this long process. And in that case, generally, you already have all the opinions worked out. You already have an idea of what you want to do. And now you're just looking for someone to hopefully confirm it. And if they don't, then maybe we'll engage more people until we get someone to confirm what we're trying to say. And so it, again, with like Richard said, being intentional. And so why are we engaging? Because we care about how our students are perceiving campus, because we care that students feel included, because our education system is supposed to be about them, because we believe in the future of our students. Whatever it is, but ground to that first, because it's going to tie into everything else you do. If it's just to check a checkbox, the co-design process has already been painted. And so, and if that does come up, and sometimes it comes up where you're like, I already know the answer, I don't need to do this, or students aren't informed enough and are going to say this, and they don't understand policies and procedures, maybe someone else is better suited to take on that part of the project. Because you recognize your bias, and we all have biases. It's okay to recognize that that's where you're at, have somebody else follow through then, or navigate that and unpack that and see if you can come to a different place so that you can engage intentionally.
Fabulous. All right. Well, thank you so much to all three of you. I really appreciated all of your fantastic insights into co-design and engagement. And thank you also to our audience who stuck around. I really appreciate you all being here to learn a little bit. I'm sure that you all learned a lot, actually. Our next webinar is going to be on May 17th. That's going to be on the topic of harm reduction with the Umbrella Project out of Algonquin College. So we're really looking forward to that. We hope you'll all join us there. And with that, thank you all so much. And please complete the survey upon completion of this webinar. Thanks so much, everybody. Take care.